Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from Natalie Maupin. She's a sexual assault nurse examiner and the forensic program coordinator at Mosaic Life Care Hospital in St. Joseph. She spoke about what it's like working with victims of sexual assault. Just as a note, this show deals with some pretty tough topics and may not be fit for all listeners. Here's Natalie.
We still like to put the blame a lot on the victim. So I think a lot of times it's like, well, what was she wearing? I say she, it can happen to men. We just, traditionally say she, women. What was she wearing? Why was she drinking that? Why was she at this place? And so it's taking away that blame and that responsibility that was on the perpetrator. They've just had something really traumatic happen to them. So when they come in, there's no right or wrong way for them to respond. We all respond to trauma in a different way. And there's a whole medical science behind that, of a neurobiology of what you're going through in your brain. So just sometimes they can't even control how they're responding. And, someone's in a car accident, and we all recognize that's very traumatic. And sometimes we say, well, tell me what happened in the car accident. And they can't necessarily tell you because that was so traumatic. So they're like, I can't remember some of it, but we don't doubt that it happened. But you have someone that was sexually assaulted come in, and they obviously had something very traumatic happen, and they can't always put it nice and orderly together, piece by piece, step by step. But it doesn't mean it didn't happen. It just means their body, their mind, they were protecting themselves. They had that trauma. It just happened. Give them some time. And just because everything's not nice and perfect and orderly, and they can't account for every single thing, doesn't mean they're lying. It just means they've been through the trauma. A lot of what's involved in a sexual assault exam, just for people to have an appreciation for, how difficult it is. It's not an easy process for them to go through. Sadly, I wish there was a way to make it easier. We try our best, but some victims will say sometimes that exam was as hard as the assault itself sometimes. So you have to get DNA from them. So, different things are, swabs in the mouth, or getting their blood. Then there's pulling hair for DNA, and that can also be to help as a reference standard about other DNA you might get from the potential suspect. And then, you're having to have the patient tell you what happened in order for you to know what other pieces of evidence to collect. So they're having to relive what happened. And so I think that can be very helpful for other medical, for law enforcement or different people when they're coming in behind us after we've done that exam. To have a better understanding of that patient might be a little snippy and a little irritable. They just had not only were they just sexually assaulted, but then they had this exam that was really difficult. And when there's reports of I think they were just lying or made it up. You're not going to lie and make that up and go through this entire exam. The numbers of false reports and lying are very, very minimal.
That was Natalie Maupin, a sexual assault nurse examiner from St. Joseph, speaking about her work with survivors of violence. That's it for this week's Missouri Health Talks. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.